All right, today we're going to play medical detective. We're tackling a really common mystery. You find a lump in your neck. What is it? So let's open up the case file and get started.
Okay, just picture this for a second. You're just, going about your day. Maybe you're washing your face, and then you feel it, a little swelling, a small lump right under your jaw. What's the first thing that goes through your head? For a lot of us, it's a little jolt of worry, right? And that's totally normal.
But here's the thing. For a doctor, that feeling isn't panic. Nope, it's the first clue. It's the starting pistol for a full-on investigation. And that's exactly what we're going to do. We're going to follow that investigation clue by clue.
All right, let's get into it. Case file, the mysterious neck lump. So first things first, let's get the official lingo down. A lump in this spot is called a submandibular lump. Sounds complicated, right? But all it really means is a swelling in that little triangular area of your neck, right under the jaw. And you've got to know that area is packed with stuff, all kinds of different structures. So a lump there could be a bunch of different things. So how does a doctor even begin to figure this out? Well, they've got their own detective toolkit. We're not talking magnifying glasses and fingerprint dust here, but a really methodical set of examination techniques. The whole goal is to gather every single clue they can.
And this process is a super systematic 5-step investigation. First up, they pinpoint the site. Exactly where is this thing? Then they dig into its history. When did you first notice it? Is it getting bigger, smaller? Then they look for external clues, like is it red? Is it tender to the touch? After that, they assess its internal feel. Is it hard, soft, rubbery? And finally, they test its mobility. Does it move around or is it stuck in one spot? I mean, every single one of these steps uncovers a crucial piece of the puzzle.
Okay, so now that we have our detective method down, it's time to bring in our first group of suspects. And they are the salivary glands, which, surprise, surprise, are located right in that submandibular area we've been talking about.
So, suspect number 1 is something called a salivary stone. The fancy name is silolithiasis. You can basically think of it like a kidney stone, but for your saliva gland. It's just a tiny little mineral deposit that forms inside the ducts that carry your saliva. And the clues for this one? They are super specific. The classic sign, the real giveaway, is pain and swelling that really flares up when you eat, or even just think about eating. And why is that? Well, your glands are trying to pump out saliva, but the stone is causing a traffic jam. The symptoms can kind of come and go, and sometimes if you press on the lump, you might get this foul-tasting saliva. Yeah, those are some dead giveaways. Okay, let's move on to our next potential culprit. And this one, we have to acknowledge, is a bit more serious. We're talking about a neoplasm, or in plain English, a tumor of the salivary gland itself. This is what happens when the cells inside the gland just start growing when they're not supposed to. Now, I know that word tumor can be really scary, so before we go any further, it is really important to know that the majority of these, we're talking about 60%, are actually benign. That means non-cancerous. But, there's still that 40% chance they could be malignant, and that is exactly why getting a real professional diagnosis is absolutely crucial. And a good detective is always on the lookout for that one critical clue, right? The smoking gun. In this case, a major red flag for a malignant tumor is a feeling of numbness in the front 2/3 of your tongue. So why would that happen? It's because the tumor might be pressing on or growing into a nearby nerve, the lingual nerve. All right, we've got one more suspect to check out from the salivary gland family. This one has a kind of weird name, a plunging ranula. What is that? Well, it's basically a type of cyst that forms when a salivary gland gets blocked or damaged. Mucus escapes and pools up, creating a swelling. And this one has a really cool visual clue. It's pretty unique. If a ranula is close to the surface, it can have this very distinctive bluish translucent color. It's even been described as looking like a frog's belly, which, get this, is actually where the name ranula comes from. How cool is that? All right, time to move our investigation along. If the salivary glands check out, a super common culprit we need to look at next is the lymph nodes. I mean, your neck is just loaded with them. They're like the security guards of your immune system. So why do lymph nodes swell up? Well, there are a few main reasons. By far the most common is just a simple acute infection. Your body's just doing its job, fighting off a cold or maybe a little skin infection. Less often, it could be a chronic or long-term infection like tuberculosis. And then, yes, in some cases, it can be neoplastic, cancer-related,
which is something doctors are especially mindful of in older adults. You know, this is where a doctor's sense of touch becomes a legit superpower. Seriously, the feel of the lymph node is a massive clue. For example, a node that's swollen because of lymphoma is often described as feeling rubbery. But a node that's swollen because cancer has spread there from somewhere else, that can feel rock hard, almost like a little pebble under the skin. So you might be wondering, how big is big? At what point does a doctor really start paying attention? Well, the general rule of thumb is about 1 centimeter. Anything bigger than that is usually considered clinically significant, and it's definitely going to get a closer look. Okay, let's get to our final lineup of suspects. Now, these guys are a bit less common, the unusual suspects, you might say. But any good detective knows you have to consider every possibility. These are lumps that can pop up from some of the other soft tissues in the neck. And with these, the clues are all about the feel, the texture. For instance, you've got a dermoid cyst, which often feels kind of soft and doughy. Then there's a lipoma, that's a harmless fatty tumor, and it's famous for what's called the slip sign. It literally feels like it's slipping away from your fingers when you try to press on it. And then there's a really rare infection called actinomycosis that can cause a super hard, woody lesion. Its nickname is actually lumpy jaw. And I have to make one last really critical point here. There's something called Ludwig's angina. Now, this is not a lump. It's a severe, fast-spreading infection under the tongue and in the floor of the mouth. This is a true medical emergency because it can swell up so quickly it can block your breathing. It's absolutely vital to know this isn't just another lump on the list, it's in a whole different league of urgency. So, after lining up all the suspects and examining all the clues, where do we land? How do we finally solve the case? Okay, as we close our investigator's notebook on this one, what are the big takeaways? First, a lump in the neck can come from a lot of different things, from something super simple to something pretty serious. Second, a doctor's exam is not just random poking and prodding, it's a real, systematic investigation. And third, and this is the most important part, while it's great for us to know the clues, the final verdict can only and should only come from a medical professional. And all of this brings us right back to that initial moment of worry, right? But now you know what the investigation looks like. You understand the kinds of clues a doctor is looking for, the history, the feel, the location. So knowing all that, doesn't it just make sense that the only real next step is to let an expert take over and actually solve the case?